Yeah,
it's good. It's good. It's good to be back on the show. Yeah.
Yeah, we had you
Good.
twice. Talked
Yeah.
about fast wave, and we IBL, shockwave. We geeked out on deliverability, crossability, emitters, and we talked about clinical updates and funding updates. And now we're going to talk about something I think that you're equally passionate about in the healthcare space. A little bit different theme, right?
Mm-hmm.
And that's Joovv, which you co-founded in 2015, right?
Yep, you got it. Yeah, definitely a bit of a different twist, right, for a device guy. But yeah, should be a fun discussion to talk about Joovv. Yeah, but we did. Yeah, we started the company in 2015 on a bit of a whim. Yeah, so very classic kind of startup story.
Yeah, tell us about that entrepreneurial story, and then kind of get into the science behind red light therapy. That'd be great.
Yeah, absolutely. So I'm trying to think of the best place to start, but why not just kind of take you back to 2015, right? Yeah. So we were in Minneapolis at the time. This was during the dearth of a Minneapolis winter. So very, very cold, not a lot of sunlight, et cetera. My wife buys a package. I'm not even sure where she heard about this, but she buys a kind of a package at a local spa. And this package involved red light therapy. And she had to go to the spa on a consistent basis, right? I think it was like 2 or 3 times a week, et cetera. But she got a lot of value out of it. And then, came back home and was like, I want to keep doing this, but kind of inconvenient. Our kids were much younger at the time. And so, they go to a spa, travel there for 15, 20 minutes, do the session, then come home. It's just like a whole ordeal. And so she was looking for something to do at home. And just like any kind of like pure play kind of device guy that spent their entire career in this field, I was like pretty skeptical, right? Like I was like, what do you shine bright red lights on your body and it supposedly yields these benefits? And I thought it was total woo science. Although having said that we've always been, I've always been a little bit more, I would say on the sort of interested in kind of the world of biohacking and longevity. So it wasn't like totally foreign, but it was still very like anyone that first comes about this is like, no way, this cannot work. I mean, this seems so silly, even if you're somewhat open-minded, like I was. But nonetheless, she was like, it really works. I've heard good things about it, et cetera. So my first inclination was like, well, what does the science really say about this, right? And at that point in time, if you just did a simple search for photobiomodulation or PBM or photomedicine, the overwhelming majority of the results, and this is pre GPT or pre Perplexity or pre any of the LLMs. So the first several pages on Google were literally PubMed results, right? I mean, no one was talking about it. Very, very hard to kind of really piecemeal any sort of mechanisms of action or like how does this work without reading the studies, right? Because again, this therapy wasn't popularized at all at that point in time. But nonetheless, the science seemed to be actually fairly legit. I was like, well, maybe there's something to this, right? I mean, there seems to be a lot of published evidence. And fast forward, several years down the road, I realized like there's a whole subspecialty of medicine, right? That's referred to as photomedicine, right? That there's these large, mostly PhDs that go to these conferences and present on podium, right, with the latest research. Yeah. So it is very much a thing, but at that point in time, it certainly wasn't as well known as it is today. And so, back then, 2000 again, kind of late 2015, kind of into early 2016, there was no. There weren't any brands talking about the therapy, and really maybe more so there weren't any products readily available to use at home. And this is a type of therapy that you need to use on a consistent basis to see results, and very inconvenient to have to go to some physical location, right, to do it. And so that someone like myself that kind of got the wheels turning, like why aren't there any brands talking about this, and then two, what would it take to make something for that's more intentionally designed for home use. And so that kind of started us down the path of kind of peeling back the layers of the onion there, and certainly more to it than just that picking up some random LED, right? That delivers, certain wavelengths of light. Definitely a lot more to it. You need to think about dosing and whether or not to pulse the wavelengths of light, et cetera. So, but net, that's kind of where we started. And so, I talked to a bunch of reg folks in my network. It was like, this is appears to be a class 2 device. Do we really, I mean, this seems silly to have to submit for clearance for a device like this, right? I mean, but nonetheless, they were like, no, yeah, you have to, and et cetera. And I was like, I don't know. I mean, does this warrant that type of effort without knowing whether or not it's gonna work? And so if I would have listened, maybe this is one of the key takeaways. If I would have listened to all of my very smart regulatory folks, or friends that I knew, I don't want to underappreciate kind of their experience.
Yeah.
If I would have listened to them, we never would have started the company, right? Because that's probably it's a multi-$100,000 effort, right, to go down that path. And instead, we were like, what if we tried to repurpose and more customize off-the-shelf gear and market them for general wellness claims instead. And so that's the path that we initially went down. And so like even the recent news about Joovv, caught my attention because I'm like, yeah, I went through a lot of those same, not at that scale, right? Because we're certainly a much larger company, but definitely a lot of the same thinking around what really ladders up to a medical claim versus a wellness claim. And so, but interesting enough, after we launched in the first half of 2016, I think maybe 12 months later, FDA reclassified the devices as 510K exempt. So still class 2, but you don't have to submit, for clearance. And so that did change the barrier of entry, significantly. So in retrospect, I'm glad we took that path, and decided to market them, for general wellness out of the gate, because it did allow us to really kind of test the waters and see whether or not this was going to stick. And sure enough, it did.
It's funny. My wife, you talked about your wife doing it, and my wife's been into red light therapy for a few years now. And I had the same reaction. Like, what is this? So now I'm a little bit in trouble. She's like, oh, you do this podcast with this Scott guy, and you go out and you buy your own Joovv, and now you're all into red light therapy. She's like, I've been onto this for years.
way ahead of the curve.
Yeah, right.
way behind.
Yeah. So she's like not too happy with me. And she's happy, but she's like, you didn't listen to me.
Yeah. It took someone else to convince you. Yeah. No, it's fine. I'm right there with you. My wife has given me plenty of those sort of reactions when she's been banging on something for months or years. I take someone else that I quote unquote trust for me to get over the hump. And so, but it's interesting. The whole therapy is kind of blown up, right, over the past. We're almost 10 years into that journey. But yeah, I mean, it's hard to scroll through Instagram or scroll through YouTube. I mean, if you do a simple search, it's talked about all the time now, right? And so it's become, I think, one of those kind of go-to therapies within that world of longevity, biohacking, athletic recovery, et cetera. But so it's kind of cool to see that we played a small part in kind of raising more awareness for the benefits of red light and near infrared light therapy.
Yeah, tell us a little bit about the science behind it, and you also said red light and near and infrared red light. Kind of go through the differences there.
Yeah, these are just different wavelengths of light. From when you look at the light spectrum, from UV to visible red light to invisible near infrared light and beyond, and that spectrum of near infrared light, specifically near, mid, and far infrared, is actually quite broad. But these wavelengths of light, interesting enough, have different physiological impacts on our bodies. And so I think everyone's familiar with UV light, right? And UVA and UVB. UVA being kind of the quote unquote dangerous. I'm not as big of I don't fear UVA as much as like most people, but UVA being the wavelength that could cause sun damage and potentially cancer, and UVB being a wavelength of light that is known quite well known, right, for inducing vitamin D production. And so most people understand that. Well, red and near infrared light specifically do sort of similar things. They have a similar sort of impact on our bodies at a different, I would say, a different mechanism of action. But nonetheless, they still have a physiological impact. And to kind of drill into that in a little bit more detail, red light is probably most known for at this point in time anyway for skin health, right? For rejuvenating skin, or at least that's kind of where it started. Largely because of the depth of penetration is different than infrared light. So infrared light penetrates a little bit deeper, but at a high level, when you think about red light's ability to kind of rejuvenate skin cells or heal wounds or, increase collagen production, et cetera, that largely has to do with the fact that its impact on mitochondrial function. So mitochondria, the powerhouses of our cells, these wavelengths of light actually stimulate your mitochondria to produce more energy. And so when you think about skin cells regrowing or healing, that's what's happening, right? Your mitochondria are sort of functioning better at a higher level and reproducing. And so that's sort of the core mechanism is really more on a cellular level. Now, having said all that, that's probably the most well understood mechanism, but there's probably 3, 4, or 5 others that if you talk to a PhD in the world of photomedicine, they'd probably say, yeah, that's true, but there's also these other things that are going on. So there's still, I think, some other theories around the mechanisms that and how they play out physiologically, but that core kind of the ability for red and these specific wavelengths, red and near infrared light predominantly, to stimulate your mitochondria, that's sort of well understood at this point.
Okay, interesting. As somebody, very busy with fast wave, probably Joovv too as well, though I think you've kind of pushed aside from that a little bit, right? And have people operating that business, but doing a podcast and just generally killing it every day, right? You have to be in good health, general wellness, and that includes different modalities, exercise, maybe sauna, cold plunge. And I follow Andrew Berman and Ben Greenfield and all these things. So talk a little bit about that from a business context, the longevity, being able to, have high energy and to be able to do all the things that you do day in and day out.
I stepped away operationally from Joovv back in 2020, and then at that point in time, circled back around with Brady Hatcher, who I know is a mutual friend, and a few others to kick the tires on a few different more pure play medical device projects. One of which ended up being FastWave. So definitely commit most of my time to FastWave these days. But this topic I've always found. I don't want to put words in your mouth, Steve, but I'm sure you probably think the same way because you're a pretty fit guy. But when we go to these device conferences, whether it's kind of a contract manufacturing show or something like TCT, right, for cardiology, the sad part is most of the folks in the medical device world are not in great shape, right? I mean, so it's like we spend our days, and these are super smart people, yourself included, that develop these super novel, differentiated kind of sophisticated medical devices that are supposed to yield to benefit people, right, at the end of the day. But the fact that we lose sight of taking care of our own bodies, that's it's kind of a sad thing, right? And so I think all of us in the world of medtech would probably be a good thing to kind of keep that front and center, right? That we need to take care of our own health, in addition to developing devices that hopefully help others as well. But kind of circling back around to your point, it's been interesting to see that even against the backdrop of when we started Joovv, that this world of biohacking and longevity has it's begun to enter, I would say, a different adoption curve, right? Where 10 years ago, someone like Ben Greenfield, like that was really, really fringe, right? Andrew Huberman wasn't even around there, and his podcast, his platform is completely blown up, and I think that speaks to this broader trend of people are like, wanting to incorporate these types of mechanisms or these types of strategies, right, into their daily lives, even if they're not like on competing in an Ironman or competing in some sort of event, and I think it's rewind the clock 10, 15 years ago. And I think everyone's kind of seen those stories around like LeBron James supposedly spends, $100 million a year on his body or some sort of insane number. 10, 15 years ago, that would have been like wild. Right. But now it's kind of more well understood, right? Where it's his health is incredibly important, right? Not only for his own livelihood, right, but for the health of their team. And so then you see professional teams paying much, much more attention to this, right? And I saw this firsthand even with Joovv, right? 10 years ago, a lot of professional sports teams on flights home from a game on Sunday, an NFL game on Sunday, like they feed their players like the worst stuff possible. Yeah. Now that's that's unheard of, right? And they're optimizing all of that now. And so thinking about some of those concepts and then bringing them into to kind of corporate life, I think that'll be kind of another trend, right? That we see play out hopefully over the next 10, 15, 20 years, and more companies, whether they're small or large, begin to think about, look, if what should I supply Joovvs, right, or some other device, right, for my people, my employees, so they can perform at a higher level, they can perform better. And I hopefully that trend will play out, because I really think it's incredibly important that if we're optimizing our own lives, right, and our own health, that undoubtedly is going to play out into kind of our business performance, right? And I've always kind of been a sort of a believer in that. I've become even a bigger believer in that over the past decade.
Yeah, I think some of the trends in alcohol consumption are going down, which is good. And I'm 18 months no drink, so yeah, I'm
doing better than me.
Yeah,
I still enjoy a glass of wine, but still fine, mind you.
It's tough though. You go to all these trade shows, and that's the culture, right? Meet for a couple of drinks, and the whole model of staying out till 3:00 in the morning and then going to the show in the morning, trying to be a functional human being doesn't work for me.
And I'm sure you've noticed it just as I have. Like, as I get older, like that's so difficult to recover from. I mean, it's harder. It's hard in and of itself, but especially as you kind of get older, it's just like your body can't keep up, I do think, kind of going back to this theme of looking at alternative ways to enhance our own health, and how that plays out into business life, I think is really interesting. And I think a lot of even the bigger strategic companies in our space, they would be wise to almost have a department, right, that focuses on this. How do we optimize and empower our employees to like perform better through better health, through different kind of mechanisms like we've chatted about.
Absolutely. I want to go on to something different, a little bit different, but related. And you posted something really interesting last week, I believe, maybe earlier this week, about Rick Rubin and your opportunity by chance to meet him. And the theme was, the biggest brand moment may not come from a campaign itself. Instead, it could come from a coincidence. And I just love that. And if you can kind of share that story a little bit, I think that's really
So this, just to set the stage, this was one of the first conferences that we attended for Joovv. So early in the company's kind of infancy or life cycle. And so going to a conference was kind of a big deal. But at that point in time, Bulletproof, which was, I think some people may know it from the coffee brand Bulletproof, right? But Dave Asprey was sort of the Andrew Huberman at that point in time. And that was his conference, right, that he started. So this was our first conference. I think it was, if I remember right, 2017, I think. But anyway, nonetheless, a decent sized conference. And, strolling through there was this, guy with this huge white beard, and no one was around him, just by himself. And it was so wild to see that all of these people that attended a conference like that were attracted to and following people like Ben Greenfield and Dave Asprey and Dr. Mercola. If you, I don't even know if Dr. Mercola is still around, but people like that. And then arguably one of the most famous music producers of all time was coming through strolling through the exhibit hall. No one was around him. He didn't have anyone with him. And I was like, that's so interesting, right? It kind of depends on, your famous kind of largely depends on where you're at, and so, but anyway, that eventually started a connect. I had no idea that Rick Rubin was into longevity and biohacking. And so we had got to know Ben Greenfield through a partnership. And Ben Greenfield was one of the first, I would say, we call them KOLs, but health influencers that help really put red light therapy on the map. And Ben connected me with Rick, and that started kind of a relationship. And because we were in Southern California at the time, that allowed for these one-off moments, as you mentioned, and to be able to take advantage of those, right? Is because of that proximity to where Rick lived, and he was in Malibu. And so kind of shortly thereafter, after like some email exchanges, Rick asked if we could, put a full body system in his house. And I was like, well, yeah, absolutely. Can we record a conversation or something, in exchange? And he was happy to. He's actually a really nice guy. And so, went to up to his house in Malibu. It was actually a house that he was leasing at the time because his main house actually burnt down in one of the fires at that time. And so, but yeah, super, super nice guy. And very, very into longevity and biohacking. That was kind of a super influential part of his health journey, right? And I think he lost 200 or 300 pounds or something like that. It was nice enough to record a podcast with us. And so just a weird thing. I'm born and raised in Des Moines, Iowa, and so it's kind of one of those, you zoom out moments, like, how did I get here, right? Recording a podcast with Rick Rubin about red light therapy of all things, in biohacking.
Didn't see that
coming. But I think to your original question, there's probably two things that stand out amongst others, about that kind of that coincidence, if you will, is one, proximity, which I touched on earlier. If we had been living in Minneapolis, right, and that would have meant, that exchange of emails and the text messages would have meant like I had to schedule a flight and plan for that and et cetera, like all of the logistics that come with a cross country sort of traveling cross country like that. Where because I was in Southern California, it was like the next day I could go drive up to Malibu, right? So, being in proximity matters. And I tell a lot of the younger folks in the MedTech space, especially that are interested in startups, like if you can afford, if you can take the risk and afford to get to a place like Minneapolis or Boston or the Bay Area or Houston, maybe Philly as an example, get to one of those ecosystems, because those proximity matters and those coincidences will come up a lot more often, right? And that kind of maybe segues into the next point, is that at that point in time in kind of Joovv's life cycle, red light therapy was kind of picking up some steam a little bit, we could have put together some master strategic plan around how we're going to build relationships with these 4 or 5 key KOLs or influencers, and how's that going to ladder up to reaching the next layer of the adoption curve, if you will. But no, it was literally just being at a conference, seeing someone like that, trying to make the connections, right, and then just building a genuine relationship. And I think a lot of that just speaks to kind of being in the mix. And those types of opportunities a lot of cases aren't planned, right? There's no some master strategic kind of business plan that was built around that. It was just being in the mix and being available, and then, tapping in, obviously trying to tap into that opportunity, right? But it presented itself by just kind of being there. And that's another thing that's kind of, I really try to emphasize with others as well, regardless of whether you're in MedTech or some other vertical, like taking more reps, taking more swings at the plate. Well, you'll get so much farther. And don't get me wrong. I mean, there needs to be, ideally there's a thoughtful approach, right? But planning will only get you so far. You need to actually start taking reps and start taking swings. And that will in most cases yield a lot more of those types of opportunities that are unplanned, right? You're not gonna sort of orchestrate those types of things. So I think that's a really important point too.
That's a great point. I was at the medical technology show in Ireland about 3-4 weeks ago, and just walking the show. It was a very active show. And somebody came up to me and was like, "Hey, I see your podcasts and your videos, and really enjoy them." And we had a quick conversation. Somebody I've never met before, and he gave me his business card. And he's the technical sourcing leader for one of the major MedTech companies that we're trying to work with. It was perfect. And we just had a big meeting with him yesterday. So just total coincidence. Like you said, you got to get out there.
And that's a perfect example, because someone, like, before you started this podcast, somebody had been like, well, Steve, show me exactly, what's your plan? How are you going to produce the content, and how are you going to, repurpose that, et cetera, et cetera, et cetera. Don't get me wrong, all of that stuff matters, but the reality is, like, you're like, well, yeah, I get that. I got to learn how to do this, et cetera. But you started doing it, and you started doing it, started putting it out there, and then, boom, stuff like that starts to happen. And, you wouldn't, if you would have, like, I mean, most people would just keep planning. Right? Sorry about that.
So
yeah, but sometimes like over planning can just be an excuse more than anything else. And I think, that example you just brought up is like so perfect, right? I mean, how would that, you probably could have spent months, if not years, just trying to get a meeting with someone like that. Well, no, you actually started producing content, putting it out there, and something surfaced out of it,
Right. You could send emails and texts and LinkedIn messages, and the hit rate is very low, but bumping into somebody by coincidence, it was perfect. So I think that was a good kind of corollary to not a Rick Rubin, but a really good opportunity nonetheless.
Yeah, no doubt. Yeah.
Hey, Scott, this has been, again, third time, great conversation, and it's not going to be the last. I can assure you that.
Yeah. Well, I love what you're doing, and keep doing more of it, man. It's always a pleasure to connect, and keep going. Yeah, I love what you're doing.